you very much, the chairman of the Presidential Task Force, my colleagues in the team, media representatives here present, distinguished ladies and gentlemen. I shall begin this briefing by congratulating our Muslim brothers and sisters for a successful Salah celebration. And in that regard, I would like to say that may God accept our supplications. And particularly at this point in time, that God will heal our land and grant us peace. I thought I would hear amen. Thank you very much. I note with gladness the substantial adherence to the advisories we gave even during the celebration in most states. The increasing awareness of the disease and especially the adoption of preventive measures such as the use of face masks in public places during the celebration. We shall continue to engage our traditional and religious leaders to mobilize support for community mobilization and sensitization. Permit me to equally rejoice and celebrate children of the world, and particularly the Nigerian children, as they mark Children's Day. In spite of the low-key celebration, it does not diminish the importance of children in our world. We will continue to focus on child rights and the survival of the child. Happy Children's Day. As you all know, our response strategy is based on trace, test, isolate, and treat. Today, I shall focus on our isolation and treatment strategies. As of this morning, we have recorded a total of 8,344 confirmed cases in 34 states and FCT, out of which 2,385 have been successfully treated and discharged. Unfortunately, we have recorded 249 deaths. While most of those who died had associated comorbidities, we find that 3 out of 4 of those who have been discharged were without comorbidities. This is consistent with the fact that risks are higher for those with other illnesses, such as hypertension, diabetes, and other chronic non-communicable diseases. There is a general reduction in mortality trend and continuous improvement in recoveries as shown in discharges compared to the increase in the number of confirmed cases. Though not surprising, we are concerned about the increasing number of confirmed cases. This is because very high cases could seriously exceed the capacity of our health system to cope. Routine cases may also suffer as a result. Therefore, non-pharmaceutical preventive approach is still our best strategy. At present, we have a total of 112 treatment and isolation centers in all the 36 states and the Federal Capital Territory, with 5,324 beds. While only 5 states, including the Federal Capital Territory, have at least 300 beds as prescribed for isolation and treatment, 21 states have less than 100 bed spaces. As the number of cases increase, there is an urgent need to expand our treatment centers across the country. I therefore call on the state governors and philanthropists to take active and deliberate steps to scale up the number of beds for isolation and treatment of confirmed cases in their states. As we prepare to move into the next phase of the response, including the easing of the lockdown, we have conducted a high-level technical session on strategic output of mid-action review and identified priority activities for the next phase of the response. In addition, we have commenced development of sector-specific advisories on reopening. Training of health workers on case management is ongoing in more states. There are global efforts to find cure for the disease, and Nigeria is part of that effort. We have received a few proposals for local remedies for the disease, and these have been forwarded to relevant agencies for evaluation. For a preparation to be approved for use in Nigeria, it must be subjected to safety, toxicological, and efficacy tests, as well as clinical trials. Last week, I led the Federal Ministry of Health team to a virtual meeting with traditional, complementary, and alternative medicine practitioners to discuss and explore opportunities for local solutions to the COVID-19 pandemic. The meeting provided an opportunity for the practitioners to understand the procedures for validating medicines for use in the country. We are also able to find common grounds for collaboration. Government will support every genuine effort aimed at finding a local solution to the pandemic. Maybe just for clarity or sharing more with you about what transpired, last Thursday, we had 19 traditional and herbal practitioners in attendance. But 5 of them were physically present at the conference center, where we had the engagement, and others were online. Of course, in attendance were the heads of the various relevant agencies. And by this, I mean NAFDAC, and NIMA, that's Nigerian Institute of Medical Research. We also had NIPRID, that's National Institute of Pharmaceutical Research and Development. We also had in attendance the president of the Pharmaceutical Society of Nigeria. We had in attendance academics like Professor Olujoba from Obafemi University, a man that had worked for so many years on plants, medicinal plants. We also had Professor McDonald from the University of Benin Teaching Hospital, who has also done a lot of work, a lot of research work in medicinal plants. We had the chairman of an ethics committee, and we had other stakeholders that were present. And what we did was to ask each of those present, that is, the traditional medical practitioners, to name their product and tell us at what stage is it, whether it's been listed with NAFDAC, because that's the first step, where NAFDAC will have to determine the fitness for human consumption. I repeat, fitness, not efficacy, and not clinical trial. So, knowing those that have registered with NAFDAC and those who have not, and of course what the remedy claims to do, whether it has to do with remission of symptoms or the shortening of the period of hospitalization, or whether it is to achieve cure. And then we ask each of them to state the challenges. At the end of the interaction, what came out essentially was that, one, practitioners still have issues regarding the process or procedure for getting listed with NAFDAC. Two, the issue of protection of intellectual property rights. Every one of them was scared. And how are they sure that somebody will not go behind to patent their own intellectual property? So they needed to be assured that that will not happen, and there will be an agreement to be signed on to. Three is the issue of funding, because every of these processes will require some measure of funding. The other issue they came up with is request to have traditional medicine wards, so to speak, to exist side by side with the orthodox medical wards, which is not really strange. It's happening in Ghana, it's happening in some other countries, China and so on. That was also a request. And of course, requests regarding fast-tracking some of these processes. And lastly, how do they get patients who will volunteer? Because when you have a new remedy, whether drug or whatever, you will need volunteers. You cannot just grab people and start administering drugs or remedies on them without they themselves, volunteering on their own. And of course, they sign what you like, you may call medico-legal papers. So, these are the challenges that we observed as put across to us, and we're taking this further. What we agreed to do is, in as much as possible, see how we can fast-track the process without undercutting anything. See how funding can be made available, particularly through the PTF. And I understand that there is an agency that is willing and ready to support one way or the other. But we will do our own internal assessment so that 3 or 4 that we can push further, we would like to do that so that we can move faster on this matter. While we are anxious to find a cure for the disease, that is COVID-19, the federal government will not compromise the health of any Nigerian. We are not prepared to do trial and error with the health of our people. Whatever is approved for use in Nigeria must meet the required standard as determined by the relevant agencies. Let me at this point again advise us against crowding, as this increases the risk of disease transmission. There are global efforts to find a cure for COVID-19. Until a cure or a vaccine is found, prevention still remains the best approach to containing this virus. I thank you for listening.